My name is Dr. Iltefat Hamzavi. I'm a clinical scientist and dermatologist working in Michigan with a special focus on pigmentary disorders. I work at Hamzavi Dermatology Specialists and the Henry Ford Health System. I also serve on the board of the Global Vitiligo Foundation. I manage patients who have vitiligo, which is an autoimmune condition that is caused by a loss of melanin, a pigment found in skin. The loss of melanin in vitiligo leads to non-scaly, chalky white patches called depigmented lesions. Vitiligo can affect patients of all ages and ethnicities. Some patients think that because vitiligo impacts the appearance of the skin, it is a cosmetic condition. But patients with vitiligo can experience some physical burden as well as a range of comorbidities, which I will discuss in this video. Physically, patients with vitiligo can suffer from sunburn and depigmented lesions. Sunburn on these areas can be more than just uncomfortable. It can also worsen vitiligo by triggering further depigmentation. This further depigmentation is likely due to the Koebner phenomena, where skin lesions develop at the site of trauma, such as a sunburn. To protect their skin, patients with vitiligo are recommended to use a broad-spectrum sunscreen in combination with other sun safety measures, like seeking shade and wearing protective clothing, to ensure their skin stays safe and comfortable. Interestingly, patients with vitiligo may actually be at a lower risk of melanoma and non-melanoma skin cancer than the general population, but protecting the skin is still important to prevent uncomfortable sunburn and exacerbating vitiligo disease progression. Vitiligo is associated with autoimmune diseases. I'll cover the three most common autoimmune diseases I encounter in my practice. Patients with vitiligo are particularly at risk for atopic dermatitis, although it's not clear which condition occurs first. Patients with vitiligo can experience itchy lesions associated with the atopic dermatitis. Among patients with itchy vitiligo lesions, many report sleep disturbances and disruption to their daily activities. Atopic dermatitis is one of many comorbidities patients with vitiligo may experience, including being more likely to have other autoimmune conditions. One example is thyroid disease. Patients with vitiligo may be almost twice as likely to develop thyroid disease, many of which are autoimmune in nature. Another example is alopecia areata. Remarkably, patients with vitiligo may be more than 2.5 times more likely to develop alopecia areata than people without the condition. There are other autoimmune diseases such as type 1 diabetes, systemic lupus erythematosus, rheumatoid arthritis, and other conditions that are also more common in patients with vitiligo as compared to the general population. Elsewhere in the body, melanocytes, the melanin-producing cells that are affected in vitiligo, are also distributed in various parts of the ear and eye. The prevalence of audiological abnormalities and impairments, such as sensorineural hearing loss, may be higher in patients with vitiligo. And there's a link between vitiligo and dry eyes and ocular surface disease. Additionally, studies have shown that patients with vitiligo may be at a higher risk for developing psychiatric conditions compared with people without vitiligo. Some of the most common psychiatric conditions in patients with vitiligo are anxiety and depression, and the severity of vitiligo appears to correlate with both of these comorbidities. Patients with vitiligo and comorbid psychological conditions may be more likely to take time off of work or experience unemployment compared with patients who have vitiligo without psychological comorbidities. In summary, patients with vitiligo have a higher psychosocial burden than the general population. The physical impact and comorbidities I have just discussed may add to the overall disease burden of vitiligo and contribute to worsening quality of life and morbidity. Healthcare providers need to be aware of the comorbidities that people with vitiligo face and be vigilant for symptoms associated with them in order to support their patients fully. In summary, it is clear that for patients with vitiligo, the disease burden is more than skin deep. To learn more about how vitiligo also affects patients emotionally, check out the other video in this series entitled Unmasking Vitiligo, Recognizing the True Burden on Quality of Life.